I would say some of the best aspects for joining our team here at Dentistry at Somerset is we have an amazing team of hygienists, assistants, front desk, and they are geared towards helping the doctors be successful. Yes, we have great patients, but we also have systems in place to help make the whole process of dental care easier for the patient. We want our environment to be fun. We want it to be as low stress as it can be, and trying to set our doctors up for success so they can help a lot of people.
Dr. Nix has got a few more years of experience than I do. If I ever have a case where I think I know what I want to do, I can go to him and just say, hey, this is what I want to do. What do you think? And his knowledge is so valuable because he's probably seen it at least 5 times before me. And so just having him in the office practicing the same time I do, we really can bounce ideas off each other, and he just is able to help mentor me through some of the more difficult cases, or just even learning how to talk to patients. So that's where the COIS came in too, like that's where he learned some of that, and then coaching me on how to talk to patients, make things easier for them.
You're walking into a family and a group of doctors who are there to build connection but also support each other. You're able to bounce ideas off each other so that we're able to work together on more complex treatment plans, work together to formulate ideas for complex treatment plans, especially if you don't know where to get started. We have a great mentorship here.
Our team here at Dentistry at Somerset is a big family. We continue to grow. We like to bring people in that make us better and continue to raise the level of what we do and how we do it. Our team is fun, they get along, they support each other. Dentistry is not easy, life is not easy sometimes, but our team will rally around each other and help see us through, when we do come on hard times.
Dr. Nix and Marcy have built this team, and they really do care about the office and you as an individual growing. They give you a lot of tools in order to do so. The team is really fun. They really have a good time, and they really are there to support you. And the types of things that we learn as a team is really to help us as doctors kind of move forward.
It's a family, it's fun atmosphere, very young, youthful. Our goal is to make sure we have good connections not only with our assistants, hygienists, but also fellow doctors, and we have really great communication skills to make sure that everyone is on the same page during procedures and just throughout the practice of what's going on week to week.
I would say our practice's focus on patient care would be meeting patients where they're at, making them aware of conditions that they have, and when they're ready, we're here to provide those solutions. We're not here to sell treatment that people don't need. We're here to move people closer to health than they were before, and helping the doctors communicate that to patients in a way they can understand.
Praxis focus is to provide, of course, exceptional care, but also to make sure that every patient is individually treated to what their goals are as well. Each patient has their individual goals, and we want to make sure that throughout our time with them that they feel welcomed and understood at every appointment.
But our goal for patients is to make them comfortable, make them feel like they're in a quality environment with people that care about them, and making them feel comfortable, heard, and give them options for their dental care.
So I would say opportunities for growth in our office is the mentorship. We have multiple doctors with various levels of experience, some more specialized training, and to always have somebody down the hall or in the other office that you can bounce ideas off of. That's really valuable. My goal is to help other dentists kind of come along their journey faster than I did. We all have outcomes that aren't always perfect or what we want them to be, and so we learn lessons from that over time. My goal is that we share those lessons, that we're humble with each other, that we're all coachable, and I think that kind of environment really allows us to do things at a high level and do things that are predictable, and so the patients are happy. That's really the goal.
Every part of my dentistry has grown, from talking to patients to doing the actual treatment to learning how to work with assistants. One of the things they do whenever we have our quarterly meeting, they try to find something outside of the office, outside of dentistry to help us grow. For example, we had a Food at First, like the person who runs Food at First here in Ames, come in and just talk to us about what it would look like to volunteer or to donate or to give your time. And they found that valuable so that you can find joy in something other than dentistry, finding joy outside of your profession and like making sure you have some of that connection around here.
I started working here right out of dental school. I think coming out of school right away, you're very nervous and tentative as a dentist, just wanting to make sure that we treat patients with the best care that we can, but we still have so much room to grow. Dr. Nix has provided so much mentorship for me as I've started, and now looking back in the 2 years that I've grown, I know that I have so much more confidence in myself, but also in the staff around me, that we are going to be providing the best care every single time we see a patient.
Not only do they support my family, obviously, financially, but they support me in having my first daughter 2 months after I started. And now I'm gonna have another kiddo, and they're just all about like, how can we lift up your family? How can we make it work for you? What does your schedule look like? They really make sure that you take your time off and like find time in your year to do that and talk about scheduling that out in advance.
I would say what we're looking for with the new doctor that's joining our office is first and foremost a positive attitude. I would say humble and coachable, and also somebody that's wanting to work hard for the patients and for their team. A lot of those intangibles, people either show up with those or they don't, and there's a lot of things that we can teach people about dentistry and systems, but I think some of those intangibles in terms of positivity, being humble, coachable, and willing to work hard, those are I would say the 4 things we're really looking for.